Hi, good afternoon. My name is Rian Horgan. I am the CEO of Kindur. We're on a mission to help baby boomers retire fearlessly. I'm really pleased today to be joined by Joe Shiner, who is the CEO of Trustee. Trustee makes it really easy to sign up for Medicare, Medicaid, and Medigap. We know that because of the situation that has been unraveling with COVID, that many retirees have questions around Medicare, in particular, what their coverage looks like should they get ill. And so we want to take some time today to leverage Joe's experience and really ask him questions directly, so we make sure that we're able to answer the questions that are on your mind. So let me just start out, Joe, and just give you an opportunity to introduce yourself, and then I'll dive straight into questions.
Sure. My name's Joe Schneier, and I'm the CEO and co-founder of a company called Trustee. And as Rian mentioned, we are focused on making it easy for you to sign up for the right Medicare insurance products. Make sure you can easily understand if you should be getting an Advantage or a Medigap plan and what that means for your finances. And the goal of our company is to ensure your financial stability, especially as it relates to your out-of-pocket healthcare costs. And that's what we think about every day. Last thing I would just mention is that we are part of Medicare Blue Button and the Karen Alliance. So we sit on a number of different steering committees that are looking at what are the best type of policies to improve the lives of older adults and people who are on Medicare, also who are under 65 as well. So look forward to sharing some about what's happening during this time period and to provide any value we can to this audience.
All right, thanks, Joe, for kicking us off. So let's start with maybe just some of the basics, which is how you can actually apply for Medicare today now that the Social Security offices are closed.
Yeah, so even though the Social Security offices are closed, people are still turning 65, and it's important to not put off signing up for Medicare when you're moving into the window of your initial enrollment window. So how can you go about that? Well, Medicare has made it possible by by applying online for Medicare A and B, which you can do at socialsecurity.gov. So those are the first two sections of Medicare that you typically get when you're in the window around turning 65. For the additional portions of Medicare, like a Medicare Advantage or a supplement plan or a prescription drug plan, there's lots of ways to go about getting those online as well. There are organizations like AARP, eHealth, or most of the brokerages where you can go to sign up for those additional products as well. Um, and for Medicare A and B, you can also call them if you can't, if you don't have access to the internet. And that phone number is 1-800-772-1213.
So if I'm going to go online and start the application process, Joe, what is some of the information that I should have readily available so that I can maybe get through that application process in one sitting?
When you're signing up for Medicare A and B, there are a couple things that you want to have on hand. Obviously, your Social Security number, your tax documents from the past couple of years, date and place of birth. If you have a green card, you'll want to have your permanent residence card number. If you have Medicaid, in which case you become a dual enrollee, you want to have that number as well. It's also important to have information on your current insurance, what the current insurance you're getting now is. For signing up for a Medicare Advantage plan and a Medigap plan, in addition to the things that I mentioned, it's really important to gather together all of the medications you're taking and make sure you have a list of all of those medications, a list of the doctors that are the most important doctors that you go to, and the pharmacy that you go to. Those will be the main things that an insurance broker will be asking you for when you're signing up for the supplemental plans that cover the gaps that original Medicare has.
All right, so let's transition now into some questions for retirees that are already on Medicare. I imagine one of the questions that's on many people's minds right now is whether Medicare actually covers any COVID-19 testing.
Yes, so thankfully after February 4th, Medicare is covering under Part B, the COVID-19 test. So that is covered for you. Um, care for COVID-19, if you do test positive, is also covered in the same way that other types of care are covered under Medicare. So if you, um, you know, have to be hospitalized, then that would be covered under Medicare Part A. The doctor's visits would be covered under Medicare Part B. Obviously, just one thing to note during this time, Medicare has expanded telehealth, and we'll get into this a little bit more. But instead of going into your doctor, we really recommend taking advantage of telehealth and visiting your doctor virtually so that you can ask them questions about your health related to COVID-19 and not risk being in a setting that is potentially a high risk setting.
So let's talk a little bit about hospitalizations and coverage under Medicare.
So your hospital stays are covered under Medicare Part A, and that's the first part of Medicare, and that is covered in the same way that it and any other hospital stay would be covered under Medicare. You'll have a deductible that you'll have to cover. If you have a Medigap plan, sometimes that will cover part of that deductible, but the deductible is for each benefit period. It's around $1,400. After that deductible, for the next 60 days, you're not paying anything for being in the hospital, and then for 60 to 90 days and 90 days and above, there's a co-payment that you would be paying, a co-insurance payment. Um, if you end up needing to move into rehab or into a skilled nursing facility, there are some changes that are happening that we could keep you informed about around payments for those, but typically those have their own separate payments as well.
All right, so Joe, you mentioned a little while ago telehealth. I imagine for many retirees, it may not actually be something that they've used before. Can we just start with kind of a definition of what telehealth actually is, what the possibilities are, and then we can talk a little bit more about the specific coverage under Medicare?
So typically, so first of all, telehealth. Telehealth is anytime when you're getting treated by your doctor or having a consultation with a doctor that is not in person. So this is a virtual visit. That visit could be through a text. It could be through video channel through Zoom, that type of thing. There's also a whole bunch of different telemedicine platforms that different insurance companies are using, and there's lots of ways to be able to connect with your doctor when you're not seeing them in person, and that's the main thing that telehealth essentially is. Um, Typically in the past, this was only covered for people that were living in rural areas of the US to be able to expand the reach of doctors into those areas. But Medicare has changed some of that because of COVID-19, allowing Medicare beneficiaries to use telehealth services and have that covered and paid for by Medicare. And so it's a really big advantage, and I really recommend that people look into that and use that type of service rather than going in person to your doctor, if at all possible.
Okay, so I think what I just heard from you there then, Joe, is that Medicare does cover health and virtual doctor's visits. There's already been a process in place for rural America, and that process is being leveraged. So in order to find out kind of whether my provider has telehealth services, where should I go to find that information?
So there's two ways to find out if your provider has telehealth services. The first is your provider network, so your actual doctor, or if you see them through a network of doctors, like in an HMO setting, may have sent you an email in the past couple of days, or if you look on their website, they may now have a notification saying, here's how to connect with us through a telehealth service. The other way to find out if you're eligible for telehealth services is to go to your insurance company's website. Many of them will have a notification now saying this is the telehealth service that we are using, and that we recommend that you use that. And in order to take advantage of that through your insurance company, you would need to be able to know your login. So have your login and password ready to be able to access it that way. So those are the two ways that I would recommend finding out if you have those services through either your provider or your insurance company.
Okay, fantastic. So let's switch over to prescription drugs. Anything that I should be aware of when it comes to accessing prescription drugs, just to kind of in this moment in time generally, or anything specific to COVID-19?
So specific to COVID-19, right now there still isn't a vaccine available, but Medicare does a really good job of covering most vaccinations for older adults. So I anticipate that as soon as that comes to market, that Medicare will be covering that, but we don't have a time frame on when that's going to be coming out. Um, I would say this is a time of uncertainty, but don't take any medications unless you talk to your doctor about them. There's a lot of uh, information floating around on the internet, but make sure you get advice from your doctor before you take any new medications during this time period. I would also recommend that you check in with your Medicare plan and see if it's possible to switch to an e-pharmacy that would deliver your medications to your house. That's another way to avoid getting in contact with a lot of other people and be able to uh, reduce your personal risk.
All right, so the last question I had, Joe, and then maybe some other questions you're getting from your customers, so maybe we can wrap up with anything that we've missed. Maybe just going back to a customer today that's just thinking about enrollment options and really trying to consider Medicare versus Medicare Advantage, particularly in this moment of time. Any specific guidance that you would give?
Yeah, so the biggest decision you're going to make and the biggest difference between moving on Medicare from your employee-based insurance is the choice of how to cover the gaps in coverage that original Medicare doesn't cover. So original Medicare, which is Medicare Part A and B, covers 80% of your healthcare costs. It doesn't cover your prescriptions. And so what you do is you have the option of either getting a prescription drug plan plus a Medigap plan, or getting a Medicare Advantage plan, which would contain all of these different coverage options in one plan. And I'll quickly just say the pluses and minuses to both of those. So the original Medicare package with a Medigap plan and a Part D plan, the advantage of that is about 98% of doctors accept those plans, and you can go anywhere in the country and pretty much be assured that in any hospital setting, in any doctor across the country, you'll pretty much be able to be covered through that type of plan. Now, the downside of that is that there's a premium for those plans that you pay out of pocket can be somewhere between $200 to $600 a month. And so for some people, that can be out of reach for them financially to be able to cover. Medicare Advantage plans typically have a uh, zero to under $100 premium, so they're quite affordable on a monthly basis. The downside of those is that they're similar to employer-based insurance, where you're going to have to work within the network of doctors that are covered within your Advantage plan. And so it's possible to go out of network and to incur costs by going out of network. And there's more risk of incurring out-of-pocket healthcare costs with the Medicare Advantage plan because of that, because of having smaller networks of doctors and providers within them. That said, it is a much lower monthly amount, and for some people, that is really is the right option. And the last thing I would just say with original Medicare is that it typically doesn't cover vision and dental, so you do need to get in of COVID-19. If you're turning 65, making smart decisions around Medicare is still critical, even in. And so my real strong overarching encouragement is you can sign up online for Medicare. You don't have to delay it until after this crisis is over. You can get your medications delivered to you online. Most of the provider services you can obtain online. And we just highly recommend that as much as possible, staying away from healthcare settings, but not delaying your just trying to access that care virtually rather than doing it in person. as our overarching recommendation to Medicare beneficiaries.
Okay, thanks, Joe. Is there anything else that we haven't talked about today that you think would be important for our customers to be aware of?
Um, just the last thing, I know that a number of Medicare beneficiaries that we've spoken to in the past couple of weeks have been concerned about potentially needing to continue working because of seeing their 401ks hit, and wondering if they're going to be able to retire, and then balancing that with being afraid of layoffs. And so there's the one thing I would say is make sure to talk to a financial advisor about some of those decisions. But and Medicare A and B, even if you continue to work, you can access those even while you're working, and we do recommend that you do that around the age of 65. It's good to have that supplemental insurance even if you do continue working, and that's been a question that people have asked
Mhm.
recently. And
No,
yeah.
yeah, that makes sense. I think what's been interesting as we've gone through this crisis is that there are actually, a number of people unfortunately have been losing their jobs, but there are also another set of new part-time work opportunities coming out, whether it's through Outschool as teaching, whether it's emergency telehealth or medical providers. So I think that's a question that is very relevant for people that are in their early days of retirement. So maybe I'll just wrap up with a couple things. So the first thing that I heard from Joe today is that if you are turning 65 and need to start your enrollment process, you can do that online at socialsecurity.gov. You can also call the Social Security office, which is 1-800-772-1213. If you have questions about telemedicine, you could reach out to your insurance carrier or your provider. But there are a plethora of telemedicine opportunities available now, which particularly in a time period where more and more of us are in self-isolation becomes particularly critical. And then finally, on the prescription drug side, just make sure that you have that ability to use a pharmacy. And so if you can switch over your pharmacy so that you can get delivery, that's another way just to protect your own health and safety during this crisis. Joe, thank you so much for your time today. Really appreciate you being able to take some time out of your, I know, very busy day to share your wisdom with our customers. As always, if you have any questions, feel free to reach out to Kindur. We're available via our email, which is support@kindur.com. You can also reach us via our website, which is kindur.com. Thank you very much.
Thanks, Rhiannon. Talk to you. Stay safe.